23. The Prime Minister has just said something about David Bowie, tweeting a tribute. I grew up listening to and watching the pop genius David Bowie. He was a master of reinvention who kept getting it right. A huge loss. There'll be many, many other words expressed as the morning and the rest of the day goes on. But let's turn now to the junior doctors' strike, because if you need to go to hospital tomorrow, don't be surprised if you have to cross a picket line to get inside. Don't be shocked if you're turned away if you don't need emergency or urgent care. That junior doctors' strike for 24 hours from 8 a.m. tomorrow, the first in a series of planned walkouts, the first in more than 40 years. Well, what impact will it have? Let's ask Rob Webster, who is the Chief Executive of the NHS Confederation, which represents the trust, the health authorities which commission and provide NHS care. Morning to you, Mr. Webster. How worried are you, how worried are your members about the scale of disruption to patients?
Well, I think I'd start by saying that we should say thank you to all of the staff at local level who are trying to minimise the impact on patients tomorrow. Good relationships, I think, between doctors and other staff and management and staff side at local level are making that a reality. So what we should see tomorrow is that there will be some disruption, but GP, 111, pharmacy and other services will be up and running and people should continue to use those. Having said that, and having thanked people for working well together locally, we do know that about 4,000 patients will be affected who've already had their procedures cancelled. And that's in a context where we might usually see about 30,000 procedures taking place tomorrow.
The Chief Medical Officer has gone further, though, hasn't she? She's warned of harm to patients. Can you rule out that patients will not be made more ill or indeed, God help us, die as a result of this industrial action?
When you've got the backing of consultants working in your hospitals to make sure that services are safe and that contingencies are being put in place to make that happen, I think that the damage to patients and the potential damage to patients is minimised. When you are cancelling 4,000 procedures, what you are doing is disrupting the lives of 4,000 people and their families, and you're making them more anxious. And I think that we should all regret that. I think it's something for which we should be sorry, and we need to make sure that it doesn't happen again. Those 4,000 people are being put out, and their health could be damaged.
What is your view of how reasonable the junior doctors' complaint is? Because their anger is not simply due to pay, is it? And not simply due to moves by the government to try and railroad through a 7-day NHS.
That's right. I think we need to look at this in the round. The Academy of Medical Royal Colleges, which is a very trusted body which brings together all of the Royal Colleges, said back in November that the contract is just one of the issues that junior doctors are concerned about, and training and the shape of training is another. The attitude of senior doctors to their junior colleagues isn't always as good as it should be. So there's a number of things that need to change if we're going to get through this. What is pretty clear is that tomorrow we've got good contingencies in place because of the commitment of doctors and other staff to make that happen, and that we'll only get through this if we go back to principled negotiations. And that means both sides have to get back in the room with ACAS and with Sir David Dalton, who's now come in to help with a number of other experienced chief executives. Otherwise, we'll continue to fail patients, and that's the biggest issue here. We can't fail patients in a modern NHS.
Rob Webster of the NHS Confederation, thank you very much.